It's another episode of Social Distancing at the Chamber. As always, it's Happy Hour with Hammer, joined by the CEO of the Chamber, Glenn Hammer. Glenn, no guest tonight, but plenty to talk about.
This is like original Coke. We're back to the formula that launched this enterprise.
That's right. We have a full pipeline now, so don't get used to it. Wanted to talk today about Governor Ducey's press conference. He was joined by leadership from DHS, the National Guard, but the big news coming out of this was, what does life look like after April 30th? Small incremental change, but an important one for the healthcare community. Tell us what the governor had to say today.
The big headline was that starting May 1st, elective surgeries will resume in some capacity. And that's, as the governor said, he's going to start moving up the dimmer switch on the economic activity of the state. So that's going to be good for our hospitals that have just been tattooed by the economics of this. But it's also going to be good for a lot of people in Arizona who have held off on surgeries as well. Yeah,
Glenn, it's an important point to double down on. You did a radio hit in Tucson today, and this has come up in a couple of interviews you've done, that elective doesn't mean not important. It's not just cosmetic surgery, for example. This is stuff that we all depend on.
Elective really just means that you could put it off. So it for a lot of it, it's absolutely essential to staying alive. And a lot of the procedures, whether they're colonoscopies or things related to cancer or severe spinal injuries, these are surgeries that need to get done. And I'm glad that starting May 1st, we're going to start seeing that activity resume.
And this thawing out not only has an effect for the public's health, as you said, individuals who need care or some sort of screening, but could also help thaw out the financial situation for healthcare providers, either in hospitals or surgical centers that, to use your word, they've been tattooed.
I mean, hospitals and healthcare providers across the state and across the country are now in the process of laying people off. And we need our healthcare sector to be very strong. Again, a lot of people don't necessarily make the connection. They figure, well, COVID-19 is surging. The healthcare industry needs to be the one that has got to be healthy because we need all of these workers. But that's really not what's going on. What's happening is that a lot of the care that they're providing is under the rates that they need to even break even. And while that's going on, they're not able to do the elective surgeries. Now, the reason why initially was the right one. We had to tell, what is our capacity for beds? What's our capacity for ICU units? What's our capacity for ventilators? We didn't want the whole system to collapse. Because we've done a very good job managing that situation, Dr. Garrick in the lead of the governor's efforts, we can even have this discussion about reopening parts of the economy that have been closed because of this health crisis.
All right, let's talk about what the governor had to say today. It's a phased-in approach based on up-to-date data and readiness, mitigating the risk of a resurgence, protecting the most vulnerable, implemented perhaps on a statewide level, perhaps on a county-by-county basis at the governor's discretion. The governor said it's his preference to do things statewide, but at the top of the list here is protecting the public's health and using reliable data. So before we get into some specifics, your reaction to the big picture.
Yeah, I believe the governor framed it the right way. And we've talked about this before. I mean, the Trump administration's reopening plan relies on the governors. And, and I would agree with the governor. I'd prefer to see a statewide approach. However, if we have a situation where there's counties in Arizona that are in a different place, good or bad, and we can open up some economic activity that's closed, my guess is that he would pursue that increased economic activity so long as we could do it safely.
Right. This is one of those times where it's never good to get cocky, but in his report today, he talked about Arizona being fortunate that it has hospital capacity, it has ICU bed capacity, and it has ventilator capacity. He said, quote, "We're prepared." Glenn, you don't get there by accident, though. It's because of the mitigation steps that they've put in place.
Yes, so we've had real success, and this is something that we should take a pause and just say that the governor's team have done an excellent job of this. Now, part of what's happening, though, is that as we've uh, basically locked down our hospitals to the point where we're comfortable that we could handle this surge
Mm-hmm.
at this point in time, and that could change, these models change, people are getting some ants in their pants and want to resume more economic activity. Now, the governor made it clear he wants to resume economic activity, but he's only going to do so based on data and based on a degree of certainty that we're not going to go backwards.
Right.
Because if we do reopen in a way that's not responsible, and we do have a surge that our hospital system is not prepared for, I don't have to tell you or any of our viewers what will happen. There will be a close, and it will be harder, and it will be longer.
When leaders make these decisions around the country, governors, big city mayors, they make these decisions when it comes to stay-at-home orders. Nobody makes these decisions lightly. Point that you've made before is especially Doug Ducey, who comes from the private sector. He was a business leader. He used the word reluctant. He didn't want to do this, but the steps resulted in some of the better outcomes that you've described.
Look, he's the leader of the best economy this state has ever seen in our entire history.
Yeah.
I mean, before the economy was stopped mid-pitch during spring training, the number one problem for our members, Garrick, was they couldn't find workers.
Yeah.
And it was across the board, across the state. So, I thought his words were very encouraging. We entered this the strongest in the nation economically.
Mm-hmm.
And if we're responsible, we're going to get to the other side of it in a leading position. But we need to be responsible. And Garrick, and I do believe a big part of that is going to fall to us as in Chamberville as well. Mm-hmm. I mean, we're going to have to really break this down sector by sector, come up with those protocols that will protect workers and create confidence among consumers to resume life as normally as we possibly can before we have more effective treatments and a vaccine.
These sector-by-sector approaches, as you've laid out, they might look different. If you are in an office environment, or if you are working shoulder to shoulder in an environment where you have daily face-to-face customer interactions, you might have to take different steps.
That's exactly right. And there's not going to be a one-size-fits-all approach here. But we're going to have to find the right protocols, and then we need to protect businesses that embrace these protocols. What we don't want is to have a trial lawyer bonanza as businesses across the state are trying to get back up off their backs, and they're doing the right things, and they're adopting the best possible safety protocols. So we're going to have a lot of work to do, both in terms of the voluntary activity of businesses to make sure the workplaces are safe for workers and customers, as well as that policy framework to protect our businesses and our medical professionals that are doing the right things.
Yeah, in terms of talking about, I believe the governor used a term, not new normal, but a temporary normal. I scribbled down some notes here where he said we might be noticing increased sanitizing efforts and conveying the sense of comfort and confidence to consumers, something we've talked about. If Mr. and Mrs. Arizona are staying home and not spending money, well, then all of this doesn't matter.
Well, that's right. And I thought it was very useful. He mentioned the increased telecommuting. We're all telecommuting now. If you could telecommute, you really should, for as long as this goes on, because you're reducing interactions that could lead to the spread. You mentioned, the things related to personal protective equipment, masks, hand sanitizers, better hygiene in terms of washing hands. All of these types of things, social distancing, all of these types of things are going to be important as we continue to thaw out our economy.
It strikes me that the governor is continually being put on the spot for answers about dates certain. When are we going to do this? When are we going to do that? You've experienced a little bit of this line of questioning yourself, and I think he answered it right. we're going to be guided by public health first and foremost. It'll be gradual, responsible restoration.
Yeah, this isn't the type of thing like Christmas or Labor Day. There's no set day where that invisible enemy, the coronavirus says, ooh, you could resume in the middle of April, or it sets its own timeline. But all the actions we're taking are helping.
Yeah.
I mean, we're not Italy, we're not New York, and again, this is not criticism of those locations.
Yeah.
We've learned from the experiences of others, and we're handling this really well. Now, I do think, though, that we're going to have to continue to look in a smart way, like the governor did on elective surgeries, that where we can make the case that we can resume economic activity and do so safely. Mm-hmm. I believe that we need to continue to do our best to make progress, because let's face it, what's going on right now in our economy is really ugly. 400,000 plus lost jobs in the last month, small businesses dropping like flies. So I'm sensitive to that as well. And there is just a balancing act here, Garrick. It's a high wire act that is really difficult.
It's a high wire act, as you said. It's very difficult and without easy answers, because as the governor said, and you just alluded to, it's being based on things like hospital admissions and symptomatic cases. And and these numbers vary. He even said, in referring to a chart at his press conference, if you notice what the trend here is, there is no trend. So these are very difficult decisions to make on a really hour by hour basis, Glenn.
Yeah, no, but I've great faith in the governor, great faith in Dr. Chris, great faith in Sandra Watson, who's leading the governor's economic response, great faith in Debbie Johnson, who's done a great job in tourism for all those years, the sector of the economy that's probably been hit the hardest. So we're making progress. It's slow, and the governor said that we're going to need to have patience, and we're going to need to. But again, as we have that patience, it doesn't mean we can't plan. It doesn't mean that we can't really look hard at some additional areas of the economy beyond elective surgeries that we can safely reopen. And I'm confident that we're going to continue to have reopening activity move forward safely as we still battle a disease where there's no real effective cure and certainly no vaccine.
Yeah, that's right. Just a quick thought. We had a guest in our previous show, so I wasn't able to get your thoughts on the Senate finally came around to injecting billions more into Paycheck Protection. We hope that those funds will start to hit businesses sooner rather than later, but just your quick take on the Senate finally getting off the dime.
Yeah, thank God that moved forward, because as businesses are doing the right things, a lot are going out of business, and a lot of people have put their entire life savings, their entire family's life savings into these businesses. Having these federal programs like the Paycheck Protection Program that could help provide that lifeboat for the next couple of months to cover payroll, rent, and expenses keeps those businesses afloat and keeps those employees connected to those businesses. So we're very happy with what happened in the Senate. Mm-hmm. They're now up to, I'm trying to do the math, 310 billion over 250. Is that 360 billion? Yeah. They're probably going to have to get to $1 trillion. Mm-hmm. But every penny directed to keep our small businesses alive over this temporary but extremely trying time mm-hmm. is, in my opinion, money well spent. So good job, U.S. Senate. Let's get it through the House. It also has some important funding for our hospitals, $75 billion, and $25 billion for testing. And we all know there's no way to return to anything resembling normal United States of America economy without more robust testing. So I feel we're making progress across the board now.
Yeah, that point on testing, the governor mentioned at his press conference today, that it really runs on two tracks. One is, are you sick today? Are you COVID positive? Track two, have you been COVID positive and perhaps asymptomatic, but do you have the antibodies? So kudos to the University of Arizona for ramping up things in a big way on those antibody tests.
Well, every time I hear Dr. Robbins speak, he's a world-class doctor, in addition to being a very fine university president. We're lucky we have him on the case, and all of our, I'll say all of our universities have been part of the solution on PPE, on testing, and other distance learning, on all the different parts of this crisis.
Yeah, absolutely. Yeah, they've stepped up in a big way. Glenn, it's the fastest 15 minutes in sports. So we will shut this episode down. We've got some good guests in the pipeline. But thanks for tuning in. As always, you can find Glenn at Glenn Hammer or at AZ Chamber. We'll catch up with you on the next episode. Thanks, Glenn.
Thank you, Garrick.